Joining me tonight is Dr. Seth Resnick, the chair of the Psychiatry and Behavioral Health Department for Advantage Care Physicians in New York. Dr. Resnick, thank you for joining us tonight.
Thank you for having me.
All right, so first question, what are you hearing from your patients, from just the general public right now? What is on their mind, and what are they saying to you?
There's just, as we know, a lot of uncertainty for all of us right now, and that uncertainty is something that is hard and difficult for us all to manage, and patients are just trying to figure out how to survive day by day with changes that we're all facing, with some experiencing job losses or family losses, lots of anxiety about the unknown. That's really front and center for us all as we go through this together.
Yeah, isn't that the worst of it? Although for some people, the unknown isn't so unknown anymore. You know, people have lost their jobs, they've lost loved ones, and they're going through this. And, you know, most people can endure maybe a week of inconvenience, maybe two. We are now a month away from getting back to normal. We are, at least, what advice do you have for people who are now, having to cope for weeks and weeks on end with the uncertainty, everything you've already mentioned?
Yeah, well, I've seen this sort of as a triathlon or just a regular kind of workout. There was the sprint in the beginning where we were all having to face the shock of how to change our lives so quickly. And now, as the world and the community, has gotten adjusted to this temporary new normal, as the curve, thankfully, is starting to flatten, we are dealing with sort of being in this new space and just wanting to know when it's going to end. And maybe there are glimmers of hope that we're seeing in numbers. But I encourage people maybe not to focus so much on the numbers and on what's ahead. They can plan, they can look at those numbers, but then take some distance from them and focus on the day-to-day, focus on the here and now and how you're managing today, setting a schedule for the day, providing yourself with structure just to get through the day. And in that, finding some routine, maintaining routines that you've had before as much as possible in this very new and strange situation we're all in.
This next question is a tough one, I know, but I think a lot of people, they have it on their mind. We learned today there are now 22 million people who have lost their job in 1 month. That is completely unprecedented. And we're now hearing stories of companies going under. So even if we do get back those jobs, many of them are gone. What do you say to people who are looking at an empty checking account, bills already past due, they can't even go out and look for a job, and they're sort of stuck inside? Trying to keep some sense of normalcy is perhaps not enough. That is a real tough reality for a lot of people out there right now.
It is a very tough reality that many people are facing. I encourage people, if they haven't in the past, now may be the time to get themselves the help that they need, whether it's mental health, engaging with family, looking into other resources online, and really reaching out, and just trying to collect their thoughts, know that this is a new time, and collecting your resources with trying to figure out what your next steps are going to be, appreciating what maybe you've been through, and focusing on your strengths, focusing on what your skills are and what maybe the next steps will be for you with finding work. I think that this is a pause and a lot is unknown, and as we get to the other side of this, things will be clearer for everyone. There is help out there. There is help, and we're seeing that. If you search, there's lots of resources available online, and I think it's also a time to really connect with others, other support that you may have, loved ones, family, friends. Maybe you can find new ways of connecting and find some consolation there.
As someone in the mental health field, what goes through your mind, though, when you hear alcohol sales jumped 50% in 1 week? That's never good news for someone in your position.
Yeah, I remember being struck that one of the essential businesses were liquor stores, which is certainly interesting. That is another area that we're concerned about. The effects of this on mental well-being for all of us is going to be long-lasting. There's the initial shock, and then people who have had underlying conditions are at the highest risk, whether it's struggling with substance use issues or past trauma. Again, with substance use issues, this may be the time to get yourself the help that you need, because we're in a very vulnerable position right now. I like to look at the sort of the growth that comes from these moments, and maybe we all find ourselves calling upon our higher angels and feeling more compassionate and more altruistic at this time, and so I think reaching out to people who you may know are at risk or struggling right now is going to be helpful. And I would also say that it's a new time, so there's opportunity to find some change. A big risk for substance users is their routine being triggered by their environment, and now for better or mostly for worse, but in some good ways, this is a new environment they're finding themselves in. Being at home is a risk, so most certainly clearing your house of paraphernalia or alcohol if you know you're at risk is important, a way to take care of yourself at home. But getting into routines, maybe finding new hobbies or new structure to replace some of those habits or behaviors that you've engaged in. And most importantly, I can't say this enough, there's a lot of help online, and we as a community have really, I think, mobilized to try to reach out to patients in where they're at. And so even support, peer support groups, Alcoholics Anonymous, the Smart Recovery, lots of other programs have peer support that are available online. So even though the brick and mortar groups may have closed their doors, there's a lot of community resources available there online to connect and get the support you need, even in helping you with your addiction.
And even beyond that, I noticed, I've had a ton of people, friends, just text me every once in a while, just say, hey, how are you doing? How important is that?
So important, again, I mean, it's hard to replace the physical connection, hugging or touching or being with people in the community. But we are all at risk for difficult times emotionally when we're isolated. And so reaching out is so important. And again, I think we're finding new ways to connect with people, and maybe even connecting with people in more ways than we had before, when we were, not as aware and just in our routines. So really reaching out and checking in on everybody. We're in this together and relying on each other at this time. I can't stress that enough, how important that is in making and maintaining those social connections, even if it's not something that you normally do or used to. Think of it as something that you can do for your health and well-being, just making that connection.
You just mentioned the importance of keeping a schedule, of course, eating right, exercising, getting outside, doing something. Is there anything else people can do to try to just keep their mind right?
Yeah, I mean, I think it's important to um, be easy on yourself in some ways, not to be too hard on yourself, give yourself compassion as well as others. And so, you can take the time to allow your mind to escape and rest. Again, don't get too stuck in the, no offense, but in the news cycle and in all the information updates. If you find yourself overly focused on that, switch what you're doing, take a moment. Using TV in other ways as a way of escaping and just relaxing is fine and okay. Things like getting centered and engaging in mindfulness or meditation are activities that maybe many people aren't familiar with. But again, there are, in this day and age, apps and online resources that if you look up mindfulness or if you look up meditation, you can get yourself some help there. And those will be some ways to really get centered, keep things in perspective, and also I think keeping as much routine and schedule and normalcy as you can. So it may sound simple, but just scheduling out your day each day or your week and the highlights of the things that you're going to do in the week. You can do a lot from your home if it's connecting, even reaching out to certain people and scheduling meetings or group meetings. I think that those are very helpful things to do at this time as well.
All right, that's great stuff, Dr. Resnick. I tell you what, we'll take a quick break and we'll be right back.
Sure thing. Thank you.
Welcome back to our coronavirus special report. I'm Scott McGee, and I'm joined tonight by Dr. Seth Resnick. He is the chair of Behavioral Health Department of the Advantage Care Physicians in New York. Dr. Resnick, thanks again for joining us. I got a question we talked about a little bit in the break there. Human beings have a very established process for grieving, and we've actually had a number of calls here from people just very upset that they were not able to be there when their loved ones died. They're not even able to be there when their loved ones are being buried. There's actually a cemetery on my way here in Yonkers, and I see people on the side of the road. What do you say to what will end up being hundreds of thousands, if not millions of people who have or will lose a loved one and they're just not able to be there?
Yeah, it's very sad and it's challenging. I mean, I know people on the front line also in the ICUs fielding calls from family who can't be there with their loved one. It's very hard. I think harking back to what we do and what how we deal with death and dying, even in normal times, applies here. For one thing, I think, that connection and valuing and honoring that connection you had with the lost loved one is important, even if the physical connection can't be made and can't be closed. There's again the possibility of having some virtual connection with family and loved ones in a memorial for that person, and knowing that you can honor them in that way, and then at a later date, when things do normalize, I think we talk often about even in anticipating loss, doing what we call legacy projects, where you can really put together a memorial for of your loved one, and sometimes doing things like that, looking at old photos or talking with family or people you were connected with through the loved one, is going to be healing, and like a lot of things, it takes time, but this is certainly a disruptive, as we were discussing, and really traumatic way perhaps to lose someone and to have to deal with that. We're trying as best as we can. Certainly, the people who are working in the hospitals are just dealing with so much, and at Advantage Care, we're an outpatient program. We're doing what we can too to sort of keep people and continue helping them so that they don't have to further crowd ERs, and hopefully we can move towards a time when we can when it's safe to go back into the hospital. But the traumatic loss is a reminder that, you know, when this is said and done, and the shock and the challenge of dealing with the present anxiety and fear goes away, we're going to be dealing with a lot in terms of the aftermaths of this. You know, there's a reason it's called post-traumatic stress disorder. The PTSD really happens a period of time after the trauma, and so, you know, as much as we can, trying to support people and having those people in a mental health and seeking out help and bereavement counseling will be helpful now in anticipation of dealing with that traumatic loss, so that it doesn't take on a really complicated grieving process as much as.
And the extension of that is, we talk about trauma, we talk about the nurses and the doctors and the EMTs and all those frontline workers. How important is it for us to not forget them 6 months from now or a year from now, when the worst of this is over, hopefully?
Yeah, certainly not. And they're bearing the brunt of this, and the hats off to them. I mean, every day knowing that they're going in there. I mean, it's something that many of us in the helping professions and in healthcare, you know, we took an oath to do, but it's very challenging to do it, especially when for a long time we didn't feel that the resources were there to make sure that we're safe. So we do need to support our healthcare workers. You know, at Advantage Care, we have held support groups and are continuing to plan on having that on a regular basis for our frontline workers. And we're holding those virtually, and hope to continue to do that. Also making ourselves available to the workers. You know, there's one thing that I think what comes from this is that, again, this is sort of a communal or universal trauma. We're all going through it. Our doctors are going through it. And what may come from this is a new relationship we have and a new understanding we have with our doctors and our healthcare workers, that, you know, they're here to support us. They may not have all the answers, but they can hold your hand and take you through the experience.
Can I interrupt you? I'm sorry, real quick, but we'll be. All right, welcome back to our special on the coronavirus. I'm Scott McGee. I'm joined by Dr. Seth Resnick. He is the chair of psychiatry for Advantage Care Physicians, New York. Dr. Resnick, let's talk about, you've touched on it a little bit, but telemedicine, virtual, how has that affected the way you guys do business? It's working with doctors, but they have, I would imagine, more limitations than, say, people in the mental health field.
That's right. That's right. I can't believe I'm saying this now, that when the 10 or 15 year ago me might have been more cautious, but, you know, again, it's the new normal, and it really works well. And psychiatry and behavioral health is a natural fit for telehealth. It's been, you know, ballooning across the community long before this, but you know, it really has been a huge help. And this is how technology, you know, really is very helpful in rising to the occasion of these kind of crises in new ways that, you know, in the past would not have been available. It's really, you know, at Advantage Care, again, we really ramped up and, you know, all got together as a enterprise and made it happen so that we could provide virtual visits for all of our patients, so they can continue getting the care that they need, even in the face of this crisis. And, you know, not just continue getting it, but get needed care that, you know, to help deal with this crisis. So again, they're not going to ERs to seek it out. It's been very helpful. I mean, so again, it's another way that we can grow as, you know, as a community, and in addition to individuals, and vocationally in addition to
Thanks,
our
Dr.
own
Resnick.
lives.
We'll
Yeah.
be right